First one is the which is false about Crohn's disease. Option A, no occurrence after surgery. Option B, aphthous ulcer. Option C, skin lesions. Option D, fistula formation. So the answer for this question is option A, no occurrence after surgery. Second one is the most common immediate complications of splenectomy. Option A, hemorrhage. Option B, fistula. Option C, bleeding from gastric mucosa. Option D, pancreatitis. So the answer for this question is option A, hemorrhage. Next question is which complication is seen after varicose vein stripping procedure? Option A, neuralgia. Option B, deep vein thrombosis. Option C, acrocyanosis. Option D, telangiectasia. So the answer for this question is option A, neuralgia. Next question is which ulcer is likely to develop in a long-standing chronic venous ulcer? Option A, marjolin ulcer. Option B, aphthous ulcer. Option C, basin ulcer. Option D, arterial ulcer. Answer is option A, marjolin ulcer. Next question is comment on the diagnosis. Option A, lipoma. Option B, encephalocele. Option C, cystic hygroma. Option D, lymphadenopathy. Answer is option A, lipoma. We can see the picture of the lipoma. Next one is the which organ has highest chances of graft rejection response? Option A, cornea. Option B, gut. Option C, liver. Option D, skin. Answer is option B, gut. Next one is which is the most common site of the carcinoma of the esophagus? Option A, lower one third. Option B, middle one third. Option C, upper one third. Option D, gastroesophageal junction. Answer is option B, middle one third. Next one is the Krukenburg tumor originates from option A, liver. Option B, stomach. Option C, ovary. Option D, gallbladder. Answer is option B, stomach. Next one is young female with painless mobile lump of 4 centimeter in a breast. What is the diagnosis? Option A, breast abscess. Option B, breast cyst. Option C, fibroadenoma. Option D, pudgy orange. Answer is option C, fibroadenoma. Next one is patient complaints of painless swelling over the face with difficulty in swallowing. The appearance of face is shown in this picture. The probable diagnosis is option A, acute parotitis. Option B, cancer of parotid gland. Option C, angioedema of face. Option C, acute sialpidinitis. Answer is option B, cancer of parotid gland. Next one is bell clapper testis predisposes to option A, torsion testis. Option B, varicocele. Option C, cancer of testis. Option D, hydrocele. Answer is option A, torsion of testis. Next one is germ cell tumor not seen in males. Option A, choriocarcinoma. Option B, seminoma. Option C, sertoli cell tumor. Option D, teratoma. Answer is option C, sertoli cell tumor is the answer. Next one is Charcot triad is used for option A, acute cholangitis. Option B, acute cholecystitis. Option C, cholelithiasis. Option D, gallbladder carcinoma. Answer is option A, acute cholangitis, in which Charcot triad is seen. Next one is Murphy's sign is seen in option A, acute appendicitis. Option B, acute cholecystitis. Option C, acute pancreatitis. Option D, acute cholangitis. The answer is option B, acute cholecystitis, in which Murphy sign is seen. Next one is, which is the most common benign liver tumor? Option A, hemangioma. Option B, hepatocellular carcinoma. Option C, hepatoma. Option D, secondaries. The answer is option A, hemangioma, which is the most common benign liver tumor. Next one is, neurogenic shock is caused by option A, burns. Option B, dehydration. Option C, hemorrhage. Option D, anesthesia. Answer is option D, anesthesia, in which neurogenic shock is caused by anesthesia. Next one is, which is the least common site for spread of melanoma? Option A, GIT. Option B, lungs. Option C, liver. Option D, renal. Answer is option D, renal. Next one is, what is the clinical diagnosis of the patient? Option A, ranula. Option B, cystic hygroma. Option C, erythroplakia. Option D, epulis. Answer is option A, ranula. We can see the picture of the ranula in this. Next one is, burn of head region in a child occurs for what percent of burns? Option A, 10%. Option B, 20%. Option C, 30%. Option D, 40%. Answer is option B, 20%. Next one is, which nerve is involved in parotidectomy? Option A, trigeminal. Option B, mandibular. Option C, auriculotemporal. Option D, lingual. Answer is option C, auriculotemporal, which is the nerve involved in parotidectomy. Next one is, most common site of splenenculi. Option A, omentum. Option B, splenocolic ligament. Option C, gastrocolic ligament. Option D, hilum of spleen. Answer is option D, hilum of spleen, which is the most common site of splenenculi. Next one is, thimble bladder is seen in option A, diverticule. Option B, bladder stone. Option C, schistosomiasis. Option D, tuberculosis. Answer is option D, tuberculosis, in which the thimble bladder is seen. Next one, Farnese gangrene is seen in option A, scrotum. Option B, shaft of penis. Option C, base of penis. Option D, glans of penis. Answer is option A, scrotum, in which Farnese gangrene is seen. Next one is, burns present as all of the following except option A, sepsis. Option B, shock. Option C, acute kidney injury. Option D, air embolism. Answer is option D, air embolism. Next one is, thrombo-angitis obliterans involves option A, arteries. Option B, veins. Option C, nerves. Option D, all the above. Answer is option D, all the above, in which thrombo-angitis involves. Thank you.